We damage the skin on every single day.
What exactly happens to our skin after 30?
Good question with not so simple answer. You have to invest in your skin quality. The more sunscreen you use, the better your skin quality will be. So when you go into the sun, your skin ages. That's it. In genetic lottery, probably 2% people have this lottery. Each of us age differently, and we actually age faster the more sugar we eat. Succinic acid is great regarding the skin. Well, cream is not a magic tool.
Hello everyone, this is Markus and welcome back to CARELIKA Talks podcast where we talk about skin and beauty. And today's episode is very special because we are answering some of your most common questions in previous podcasts, and it's about the skin after 25. And today we are joined by dermatologist Kristīne Kalniņa. Hello.
Hi.
How are you feeling today?
Good. How are you?
Are you excited to talk about this very important topic?
Definitely. I think there are so many things to discuss today.
So maybe you can explain what exactly happens to our skin after age 30.
So basically there are many things that happens, but basically if we simplify that, so there is decrease of elastin and collagen production in the skin, and that's why we start to see some fine lines, some wrinkles. Those people who like to tan, of course, we start to see some brown spots, maybe some redness in the skin. The next thing that happens, the cell turnover decreases, and therefore it starts to appear as a slight dullness and maybe some roughness. And what usually people start to complain is so wrinkles, some dullness, maybe the skin is not so bright, not so shiny. And of course, also the lifestyle affects our skin dramatically. So whether you smoke, you tan, do you stress a lot? What is your lifestyle during, what type of food you eat, and so on. But basically, all of these usual things that we say, good lifestyle, appropriate sleep, food, it actually affects the skin a lot.
So it's not only creams and like products that we use, it's a lot of side things as well.
Oh, definitely. If a person smokes, he has to invest in his skin quality, I would say 3 times more. Well, I'm not someone who judges the patient, but, I'm just telling them, if you smoke, you have to invest in yourself at least 3 times more. You can do that, but you have to be aware that this investment takes more time and also finances, I would say definitely as well, because the smoking decreases the skin quality dramatically. It's very, very visible once you're 35 or 45, because the more we age, the more we start to see your lifestyle, because I would say that approximately till 40, you can still go through that you're young, but after 40, especially in women, because of the hormonal changes, every single choice is very, very visible. If you like to drink, if you like to smoke, if you like to tan, do you take care of yourself, or do you exercise, and so on. And once this age gap comes forward, 45, 50, 55, it's more and more visible. Because trust me, no one wakes up at the age of 50 and they look good just by genetics. I would say that in genetic lottery, probably 2% people have this lottery. All the rest of us have to work to get some results. Because if you see a person in his 50s, he or she, and they look good, there is a lot of work invested in them.
So like Jennifer Lopez.
Definitely. But I would say you can also see that in a lot of Latvian, I would say celebrities as well, because that is time and that is investment, yes.
So what are the key things besides like the products and cosmetic stuff that we're going to talk about a bit later, but what about some other lifestyle choices that you would suggest? Like quit smoking, less alcohol, or skip alcohol at all?
Well, of course, like everything that you do from time to time, well, you can eat fries once per time, you're not going to gain weight of that. But if you're going to eat fries every single day, of course you will gain weight. It's not very healthy. So these choices are on everyday basis. So you have to be very crucial about your skincare routine. You have to do it on every single day basis. But regarding your question, of course, quit smoking as much as you can, and also passive smoking if you're surrounded by someone who smokes, because also the smoke, it pollutes the air. And whenever the air is more polluted, there's higher risk for hyperpigmentation. So those people who live in Asia, India, they have a lot of problem with hyperpigmentation because the air is very, very polluted. And all of these small dust particles affects the skin quality and also affects the skin barrier function. So smoking, alcohol definitely. The person should be very aware the type of products they're using, because a lot of carbs, a lot of sugar, it makes this glycation in skin, and we actually age faster the more sugar we eat. And so every tiny bit, it affects us. And so the more healthy you eat, the more antioxidants you have, the better the building material it is. Because this is, again, if you build a house from a poor quality materials, the house is not going to stand for too long. And this is exactly the same with the skin. So the better material you give to your skin, the products, food, water, sleep, less stress, it affects how you look, definitely. And last but not least, the person should be happy, because if someone is, of course, everything is around stress and hobbies and so on, but if you have something that makes you happy on an everyday basis, or at least on some regular amount of time, your endorphin levels are higher, you are more satisfied, and also it's more visible on your face as well. Not only on face, of course, but regarding our today's topic.
So let's talk about some of the myths that are out there about aging as well. One of the myths is if a cream is expensive, it must work. So how could you comment this one?
Regarding the expense of the cream, it depends very on the ingredients, but I don't agree with this statement that the more expensive the cream, the better it works, because you can find very good quality products in affordable brands as well, because everything depends on the ingredients. And you have to understand that there are a lot of labels, a lot of brands, packaging, smell, and aroma, and everything that is around the brand itself. But regarding the active ingredients, you have to choose wisely what you use and how carefully you use, and again, how disciplined you are, because this is the same as with gym. If you want to have a nice body, you have to do it on a regular basis, and the same is with the skin. So I would advise rather not to invest in very expensive creams, but just to use them on everyday basis. So this is a discipline to use it on everyday basis. But answering your question, no, I don't agree that the more expensive the cream, the better it works. It doesn't always work like that. Some ingredients, of course, they elevate the expenses of the production, like antioxidants. They are more expensive as an ingredient itself. So therefore, the product always will be slightly more expensive. But again, it's not going to cost 500, 600, 800 euros.
Another myth is anti-aging skincare should start after 40. So what about this?
This is a great one. Usually when the patient comes, he says, oh, when I will get wrinkles, I will start to do something with them, which is absolutely wrong idea. This type of thinking is the same. I will start to work out once I get fat. I will start to brush my teeth once I get some toothache, yes. So that is the type of logic. Actually, nowadays the medicine is going quite the opposite. Everything is based on prophylaxis. You come to the physician before you have any kind of problems, any wrinkles. So we start with skincare regime. We also assess the morphotype of the patient, because each of us age differently. And so regarding the morphotype, whether the patient is more prone to edema, more prone to wrinkles, sagging, ptosis, we start to invest already when we see that the potential problem that you will or someone will have in 10 or 15 or 20 years, and we already start to focus on the potential problem, then we delay when this problem actually appears. So again, no, the earlier you start, the better your results will be, because everything is in prophylaxis. Of course, you shouldn't start in your early 20s with aggressive retinols, with things like this. But then again, there are so many things that you can already start in advance. Of course, every one of us will age, definitely, but you sort of like push it a bit back, because if a patient comes with an idea that I will make him younger, that's the wrong idea. I will just slightly postpone this aging process, but every one of us will age, but with less wrinkles, with less redness, with less brown spots, with more even skin texture and so on. And we will just look better, because you've probably seen a person with gray hairs, a lot of wrinkles, but the skin quality is good. And therefore the person looks very, very good. And that is the main idea, what we try to invest in our patients when we talk with them, that you have to invest in your skin quality again, but every one of us will age. And this is also a wrong idea. You can have a perfect face, but you still have your body, and it will show your wrinkles, your brown spots. We still have our palms and elbows and knees, and you can still see the signs of aging. But again, if you take care of yourself already in your 20s, in your 30s, and you start to invest wisely, and it doesn't mean that you will have to come to me every single week. It's just from time to time, we give some like slight touch, and we maybe make some corrections in your everyday skincare routine. And my aim is actually to see you less often rather than more often when you already have the problems. So that is the nowadays medicine idea, that we actually skip all of these potential problems, like postpone them.
And there's another one. Retinol and acids are dangerous. So what about this one? Especially in the summertime.
Yeah, well, sorry for comparing, but again, like, this would be the same. Don't get in the car, you will die. Well, in every product may have some side effects, some possible irritation, some possible dryness, but there are no bad or good products. There are products that are suitable for that exact person or no. I love acids, I love retinol, but you just have to use them wisely. You have to start, I would say, slowly with some patience. You have to be aware about your skincare routine to compensate the possible dryness, to moisturize. You have to use sunscreen. But again, there are no bad or good products, and everything that you do with like respect to the skin, you can introduce them in your everyday skincare routine, definitely. Regarding the sun, of course, if a person doesn't use sunscreens, and of course not. And again, retinol and acids increase the skin sensitivity to the sun, and there is higher risk for hyperpigmentation. So therefore, probably yes, it's not advisable to use them in summertime.
If we talk about wrinkles, so what's the actual thing or product that works for wrinkles and aging?
Oh, there are many types of products, and again, it depends how deep the wrinkles are. Because if you see some fine lines, actually a good moisturizing cream will definitely help, because especially like hyaluronic acid, it plumps the skin, it gives hydration, therefore the light is reflected much better, and our skin starts to improve very, very much. So if you see a dry skin, it's actually flaky, it doesn't reflect the light so good, and therefore a person may look slightly worse than he actually looks. And so first of all, it's hydration. Regarding if you think about deep wrinkles, well, cream is not a magic tool. Yeah, it's not Harry Potter. So it depends how deep the wrinkle is. But what I usually say to my patients, we can reduce the depth of the wrinkle. Maybe probably we won't remove it completely, but we will improve that this particular wrinkle doesn't get deeper. And also we like prevent new wrinkle formation with proper care. So active ingredients that are very, very suitable for the skin are antioxidants, because they reduce free radicals. And free radicals, this is a fancy name, but basically what it means that in every day in our skin cells, these free radicals, they work like scissors. And so therefore our collagen disrupts like a zipper. And so the more we have these free radicals from the air pollution, from UV rays, it promotes skin aging faster. So if we have a good skincare with antioxidants like vitamin E, vitamin C, many others, we like disrupt this oxidative stress in the skin. The next one would be peptides. They are sort of target molecules to stimulate collagen and elastin production. So therefore the skin firmness and increases, and we also help to postpone the fine line formation. And as we talked about the retinol again, if you use retinol like for 5, 10 years and longer, but wisely, again, not to dry the skin too much, retinol works like a boss when he's in an office. You know, when the boss is in office, we all start to work a bit more. And so whenever you apply retinol, it sends the signal for the cells that they have to work. Therefore, they stimulate and they produce collagen more actively. But of course, we see these changes very, very slowly, I would say, within 3, 6, 9 months, depending what the skin quality is. But again, like this is an everyday skincare routine, but we already can invest in that in our 30s, 35, 40s. So you just have to do it wisely. But again, these type of combinations, we can see that the fine lines actually sometimes even disappear from the skin.
So it's not a sprint, it's a marathon.
It is a marathon, definitely. And this is, again, as I usually tell to my patients, this is like brushing your teeth. Did you brush your teeth? Then you see the result. You did apply your cream, but this is like on every single day basis. That is a routine. You don't go to bed without brushing your teeth. You don't go to bed without your skincare routine. But again, I think it's important to stress out there is no need to have 10-step cleansing routine or 10 creams that you apply. Actually, you should just invest in 3 or 5 ingredients or creams, and that's enough. Because the more you cleanse, the more you irritate your skin, actually the worse it with time starts to look.
What about like the difference between serums and creams? Because there are so many serums that you can apply, like vitamins and peptides and all the stuff, and then you do the creams.
So the difference is the consistency, and the difference is also the ingredients. So when you apply a serum, it goes into the skin very quickly. It does its work very fast. It hydrates. It brings a lot of active ingredients, but the serum doesn't contain these sort of called humectants that holds it in the skin. So if you use a serum in a dry room, it evaporates very, very quickly. And therefore, a serum is not enough to hold all the moisture in the skin. So with serum, we give all the necessary ingredients for the skin, active ingredients, and then we put on top of that the cream so that it holds all the good things that you applied before within the skin, so it doesn't evaporate. Of course, if someone lives in a very humid area, it could be enough with just serum, but like in our place where we live, we have a lot of dry air, especially in countries where you have central heating. It's not enough just with serums. But that would be the order: serum, then cream. And if you do that in the morning when you walk outside, then of course you also have to apply sunscreen.
What about like injections? Because you mentioned all those creams that are sort of like trying to get rid of the wrinkles, but there are those magical injections and Botox and stuff that can also maybe help to reduce them. What's your opinion on that?
I love Botox, I love injections, but again, there is nothing like super universal that you can do just one thing and then don't do the skincare routine. You can't actually evaluate what is best and what is worst. Like Botox, it works for dynamic wrinkles like our 11s, crow's feet, any kind of wrinkles, skin sagging, we can lift it up because it relaxes the muscle. So it decreases the formation of wrinkles. But then again, Botox is not a sunscreen. Botox will not protect you from oxidative stress, and Botox won't hydrate your skin. So it is impossible to compare them. But again, if you look on the hydration of the skin, then there is a cream. If you look at the dynamic wrinkles, then there is Botox. But again, I think that smart combination with all of these things gives a really, really nice results. But again, everything that you use too much, it's too visible, it changes your facial expressions. And regarding injections, again, this is a huge group to talk to about. There are some injections that gives a great hydration. You can inject like mesotherapy with a lot of good ingredients to restore your skin, to give like a boost for it to work slightly faster. There are injections like fillers. If you do them a bit, it's not visible. It actually, you fix some ligaments in your face, so you again postpone the sagging. But if you do them too much, it's very, very visible because injections are made in exactly the same points, anatomical points. And if you start to do them too much, a person looks like copy paste. Have you seen them?
I've seen a lot of
big
them.
cheeks, big lips, and they actually, if you look on 100 pictures, and you don't see the difference eventually, do you? So everything that you do like wisely and a bit, I wouldn't say that something is bad or something is good, but it depends from patient to patient. And again, we always assess the morphotype of the patient. There are some patients who will benefit from Botox and fillers, and there are some patients who will be very edematous afterwards, and they won't benefit from that. It will be very visible. They're not going to be happy because the face will be slightly swollen. So again, there's nothing bad or worse, but there's targeted patient. It's the same with the creams. Retinol is not bad or good. There are some patients who are super sensitive and they will get dry skin, inflammation, irritation. They will say definitely bad words about retinol. And then there will be patients who have normal or oily skin and they will be super happy with retinol. So we have to evaluate to whom we prescribe what.
Have you seen this latest Hollywood trend where there's been a miracle transformations for some celebrities like Lindsay Lohan and Christina Aguilera and Kris Jenner? So they disappeared for a while and then they came back with a total fresh new look.
Well, that is an art of plastic surgery and injections as well. Probably you see Lindsay Lohan before.
Yes.
She didn't look good. She was quite swollen. Everything was very visible that she had injections. Now she looks just fresh. Again, if you do like everything with a slight touch-up, you just enhance some spots because when we age, just gravity, everything goes down, but not only skin, also muscles, ligaments, and we also have bone resorption, like our eyeballs are widening a bit, yeah, and we have nasolabial folds because it goes down. But again, so if you do skincare routine and slight touch-ups, a person looks just good and it's not visible. You can look at him, you already know, oh, he's in his 40s or 50s, but he still looks good. And that is a good work. Because when the patient comes to me, I always say them, we're not going to work that something is visible. And that is, to my point, that is a bit a bad taste, I would say, because you should just look good. You still may have some wrinkles, some pores, because everyone has them, but still they are not the main character in your face. That is the main idea. But regarding Kris Jenner, definitely, of course, she had plastic surgery. And we can't compare cream to plastic surgery. But as you saw, like once everything is done like respectfully to skin, to muscles, to the age as well, I think we can see a wonderful result.
I also saw the face of Brad Pitt recently. He also...
Well, that's the work of injections.
Yes,
that's the work of injections.
But let's just talk about like natural ways, what we can do with the creams, with the serums and stuff. So what is like the sort of perfect routine for anti-aging skin?
Of course, like there are many things that you can do at home, but let's simplify that. Like in your morning routine, that would be gentle cleansing. And again, with cleansing, that depends on the skin type. It's optimal to do it once or twice per day, regarding if the skin is dry and sensitive or it's oily, combined, or like with pimples or some inflammation. So that differs once or twice a day. Then serum and moisturizing cream and lots of sunscreen. The more sunscreen you use, the better your skin quality will be. There's one simple answer. When you go into the sun, your skin ages. That's it. Nothing else. If you want to postpone that, you use a lot of sunscreen. And not only on your face, but your neck, décolleté, your arms as well. So lots and lots of sunscreen.
So what's the best way to do that? Because I personally love sun, but I also like to use SPF a lot. But when you go out in the sun for like whole day, just a practical, stupid maybe question, you apply before you go out, and then in 2 hours maybe you need to reapply. So what's the best way to do the reapply thing?
Of course, like in ideal unicorn world, after 2 hours you wash your face, you cleanse, you reapply your cream. But like in real life, of course, it doesn't happen that way. If you can, of course, that's an option. But again, you can use you reapply cream. You can. There are so many consistencies regarding like the base of SPF creams. So you can have cream, you can have fluid, you can have an aerosol, you can have powder, you can have mask, you can have sticks. So based on your type of activities that you prefer, that you do, if you're sweating a lot or if you're in the office, you can choose what kind of, what type of SPF you use, and then you can reapply different kind of types of them. So for example, you can have a spray in your car. So whenever you step outside, you just spray it all over. There are some sprays that are dry, that doesn't make your skin or clothes or hair wet. You just spray it and you go out. If you go back and forth to the market or to the shop, just put some powder and that's it. But of course, if you are the whole day in the sun or at the beach, then you have to reapply like a cream, a proper cream. It can be a fluid as well, of course, but what I mean by that, you have to reapply a lot. So it's full 2 fingers. For the face. And also don't forget about the ears. And one thing that usually people forget the most are the lips. So if you want to keep your lips plump without wrinkles and quite puffy as well, you have to reapply the lipstick with an SPF 50, like hygienic lipstick, but with an SPF 50 on your lips. That is very, very crucial. So if you want to have nice lips, like plumped, don't forget about the lips. After the summer, if you now know this, look at people, a lot of have like sort of dry and a bit cracked lips that you may see in winter time, but that is very, very often also after the summer because of the sun.
Yeah, because you don't do that with the cream because it tastes bad.
It tastes bad, exactly. But you can buy a transparent lipstick, transparent like a hygienic lipstick, but with an SPF 50, and you can reapply on your lips.
That's very
and
good
again, think always about the palms, because you know these brown spots. Usually, people say, "Oh, they are age spots," and then I usually say, "So you have age here, but you doesn't have age here." So this is only because of the sun. Sorry, but we don't see these brown spots on the buttocks. Why? Because we don't show that zone to the sun so often. So everything comes bit by bit. So whenever you go outside in the sun, this is like dropping a coin for new wrinkle, new brown spots, some redness, some telangiectasia. And again, what you mentioned, you like to be in the sun. I'm definitely for the sun, enjoy light, but just reapply the cream. And again, you can have an auto bronzer. You can still have a brown skin, but just think of that the sun always comes with the damage. Auto bronze just gives you tan and it fades away, but without the damage. So that is the difference. And the sun has this very, very cumulative effect. Nothing happens within one day, like I mentioned you with fries or with smoking for in a party. But once you have a lot of excess sun, the skin just ages. So invest, like if you have to choose one ingredient, just one, and for example, money-wise, I don't know, finances and everything, just one thing, that's an SPF 50. That's it.
50.
50. The higher, the better. Because let's be honest, do we reapply every 2 hours? No. So if you start to apply 15, 20, 30, of course, that's better than nothing. But then again, we know that we are sometimes skipping the reapply. So therefore, once you apply at least a high spectrum. So it has to be an UVA, UVB rays. So it's broad spectrum so that we don't have also wrinkle formation.
So let's touch another topic, which is also not just for the teenagers, but also for adults, which is called acne.
Oh yeah, this is a very, very common topic. And I think there is a great shift between, in the last, I would say, decade or 2 decades. Before that, we of course had a lot of teenagers with acne like we've used to, because that is the time when our puberty hits and hormones start to work. But now we have a lot of grown-up people with acne. And I think that is a contribution to our nowadays, I would say, lifestyle. Chronic stress, a very active lifestyle, a lot of screens, We want to be in charge of everything. And this constant stress also increases the cortisol, which is a very good stimulative hormone for sebaceous glands. But of course, that is not the only reason. Hormonal changes, skincare routine, maybe too aggressive skincare routine. And then we start to see these changes in the skin. But yes, grown-up acne, it's actually, I would say, sometimes hard to treat because lifestyle moments affects a lot. We can, of course, prescribe the treatment, but if a person doesn't change anything in his lifestyle, in his regime, then of course the results are not so good. But and also adult acne sometimes can be very, very stubborn. It's hard to treat because these pimples are located more on the jawline, the chin, which is hormonal active zone. So once the hormone comes, it gives the stimulation for the sebaceous gland, therefore it works, and we start to see more pimples. Sugars, alcohol consumption, wine. A lot of people are drinking wine on an everyday basis, but actually what is wine? It's sugar, and it also gives a lot of stimulation for the sebaceous glands. Don't get me wrong, wine doesn't cause acne, but again, this is like a stimulation factor. So yeah, we see these patients more and more. And I think that also the air pollution gives a lot of impact as well.
So what we do in that case, so we just grab a bottle of a product that contains a lot of alcohol,
acids
and everything, or what do we do if we have a problem of acne?
Well, the first thing that I would advise to start is think about the skin barrier, because adult acne patients, often they have very, very sensitive skin. And the first thing what they usually start with, which is quite logical, they go to pharmacy, they buy some acid-containing creams because acids are good for acne. But then again, their skin barrier is already disrupted, it's sensitive, and with alcohol-containing products and harsh acids, they irritate skin more, and they get actually more inflamed lesions on the skin. So we have to be very wise how we combine these creams, because it needs treatment, it needs skincare, but this skincare also should be very gentle to the skin, because the harsher the products, the more irritation, more redness, and they're not, actually we can worsen the skin condition by that. Of course, we do prescribe retinols, retinoids, antibiotics, acids, but then again, respectfully to the skin barrier. And sometimes it may be for 1 month or maybe longer, we start to work with skin barrier to calm the skin down a bit, and then we start to imply new products like acids and so on. So because this zone is quite often it can be sensitive to harsh products.
What about succinic acid? It's also one of the things that you can probably use.
That is one of ingredients that you can use for acne and rosacea treatment, because succinic acid is great regarding the skin, because succinic acid actually is produced in our cells on everyday basis, because succinic acid, this is like an energy factory for the cell. So if you think about it like electricity for the cell, so once you apply succinic acid, it prompts all the healing processes. So everyone who has sensitive skin, inflammation, disrupted skin barrier, redness, erythema. Well, don't get me wrong, it's not magic tool, but again, you can use this ingredient for many type of skin problems, because it integrates into the skin very, very good, and it calms the skin as well. Because when you see any type of redness, regarding whether that's rosacea or that's acne, that's a low inflammation that happens in the skin all the time. It's not maybe so active, but from time to time some pimples come, and therefore this low intensity inflammation, the skin can't heal properly. So if you add something that calms the skin and it also integrates into the skin very good, it can start to heal. This is the same. If you go to work when you haven't slept, you haven't eaten, you're not working so good. But if you've eaten, you've slept well, you can work as effectively. And that the same is with the skin. If it's inflamed, but first we have to calm it down. We have to give some ingredients that it can restore from. And then we can start to expect some glowing, radiance, no wrinkles, and so on. Because the skin needs a lot of energy if it is inflamed. So it takes every single thing to get rid of inflammation. but not for the glowing. And because also for the body, the skin is, sorry, but probably in the last place, because the skin is quite big, and we damage the skin on every single day. How we wash, how we clean, what we eat, we touch skin all the time, we rub skin all the time. Very often we use wrong products, and therefore we damage the skin very, very often, not intentionally, but unfortunately we do.
So how do we know that the product is right for you?
Good question, but not so simple answer. But actually, the skin is very, very smart. It will show you eventually. So if the product is not right, probably you may start to see some redness, some flaking, some irritation, maybe even some inflammation like pimples, because the skin starts to inflame. So basically the main thing that we have to be aware of is the skin barrier. So skin barrier, it means that the skin cells are in good shape and in good quality, and also the cement that holds the skin cells are proper. So you can think of a brick wall. So if the brick wall has a holes, everything goes in and everything goes out. The skin loses a lot of moisture, it evaporates very quickly. Also, all of the bacteria and viruses go into the skin, all the chemicals that we use go into the skin. And therefore, if the product is not right for the skin, eventually you will start to see maybe some dullness. It's not always an inflammation, but you will see some signs that the skin is not looking so good, and it will always show you that some signs. It's not like where you apply and immediately your skin is red. It can happen from, I would say, there are these quick type of allergic reactions within few days, but it can sometimes be more visible after a few months, that the patient says, I don't look so good, the skin is more sensitive. Like again, sensitivity could happen. So you wash your face with water and it's like becomes very like tight, and so some kind of discomfort, but the skin will always tell you.
And what about the opposite thing when you kind of don't see like any results, or you should be super patient?
Oh, this depends what you expect by results, because if you take good care of your skin and you buy a new product, and sometimes again, many people say, oh, but I don't see anything. If you go to the gym on a regular basis, when you wake up, do you see that your biceps or triceps on the next day? Yes. Do you see the results? So you keep yourself like on some level, I would say, and the same is with the skin routine. For example, if a person buys a moisturizing cream and the skin is dry, he applies it and he says like, wow, this is the best cream ever. And then time passes and he says, oh, the skin got used to it, I don't see that wow effect anymore. But actually the cream resolved the problem that the person had, and that's it. On everyday routine, you don't see like magic, like immediate. If you have a lot of problems like dryness, dullness, and you apply something very moisturizing, something that reflects the light well, you will see immediate results. But the better quality you have, you just maintain it. It doesn't mean that like with every week it gets more and more lifted and you see more and more results. Like again, with fine lines and wrinkles, someone says, oh, but I don't see the results on my wrinkles. But if our expression, so you can imagine skin is like a paper, and the more you bend it and now you reopen, you can still see fine lines. Our muscles make fine lines every single day. But then there comes this one magical cream that fades everything away. It doesn't happen like that. We maintain this effect. So it again depends what kind of result you expect. If a person has a hyperpigmentation, then probably within 3 to 6 months, they could start to see that the pigmentation is getting less visible, the brown spots are less visible. Yes, definitely. But if we're talking about fine lines, it depends what kind of result someone expects and what the quality of the skin is as well. So it differs what we mean by result. But again, we gain some results and then we maintain them. Exactly the same as with the gym. Of course, if you start to do bodybuilding, then you see the results. But if you go to the gym on everyday basis, like to stay fit, you don't see like, wow, something dramatically has changed. True?
This is true. What about the thing, there's like injections and creams, but I've seen this thing on social media when some people apply a scotch tape on their face before they go to sleep so they can sort of like get rid of wrinkles. Have you seen this?
I haven't seen, but probably the idea is the same as with the face tapes. So there is some logic, but I would say more with tapes. But you have to understand that. So when we sleep, we tend to make lines when we sleep. So the idea for this treatment is to apply these facial tapes to reduce this like sort of bending of the skin. But again, you have to apply them correctly. If you just apply some tapes, first of all, the skin doesn't like breathe in that place, so it gets a lot of sweat underneath there. So if you apply them once, probably nothing. But if you start to do it on everyday basis, the skin quality will definitely, you can apply just some kind of tape on your arm and then remove and then feel how your skin feels. And so if you start to do it on a regular basis, nothing good will come out of that. So everything that, there are a lot of trends. Maybe you remember that one time there was shaving face, then there were different kind of glass masks, rubbing faces, different kind of things. Of course, like everything is a trend. Like people want to try new things.
Something new.
Yes, but regarding tapes, no, I don't see that would be useful. It's better to buy a good sunscreen. And actually, from a sleeping point of view, there is a logic to buy these silk pillowcases, because then your skin sort of slides over rather than to bend you, because a lot of people start to get these sleeping lines, especially on the forehead. So with age, our skin starts to lose its density and it becomes more thinner. And also our muscles bend, like forehead all the time, and then we sleep, we make this wrinkle even deeper. And of course, it doesn't happen in one day, but with time, yes, it starts to come. So a good pillowcase, sleeping on your back, if it's possible. You can actually train yourself, but that's work. It's not so comfortable, but you can train yourself to sleep on your back, because once you sleep on your side or on your face, a lot of wrinkles will come with that.
There's another topic that people are asking after previous podcasts, and we already touched that topic a bit today, which is sun exposure and pigmentation that comes after a lot of sun. What is the reason why those dark spots become visible on your face?
Well, those reasons are different. Probably the most common are overuse of sun, overexposure of sun, tanning beds, tanning, everyday use of the sun, first of all. Then the next one is with age, we also start to get some brown spots. That is also normal. And hormonal changes, which are very, very prompt and visible in women, like called melasma. And they can have this regarding whether they had or didn't have pregnancy. But melasma, it means that there's hyperpigmentation that is symmetrical on the face, like quite big brown spots or gray-brown spots on forehead, cheeks, and upper lip, and quite visible. And that is a very, very tough condition to treat because it's chronic, it's quite stubborn to treatment, and whenever a person goes into the sun, they have a high tendency that it comes back, so the treatment is sometimes challenging for them. But yeah, basically with age, because we tan and hormonal changes, those are the most typical. And as well, post-inflammatory hyperpigmentation. Whenever a person has inflammation like acne, rosacea, any kind of maybe some burn or some trauma to the skin, those who are darker skin phototypes, they have higher tendency for the hyperpigmentation in those places afterwards, yeah.
So what's the best way to fight against that?
So look, like, it depends from the cause. Like, for example, if that is a post-inflammatory hyperpigmentation, then we, of course, have to deal with a possible inflammation to prevent it, like in acne, rosacea, good skincare regime, a lot of sunscreens. If that is due to brown spots, so-called hyperpigmentation spots on the face or uncovered areas, we can use different kind of brightening creams that contain a lot of vitamin C, antioxidants, retinol again, because it removes the horny layer of the skin. But again, lots and lots of sunscreen. The prevention is everything. Even though a lot of people sometimes complain, oh, I did everything and my brown spots didn't disappear. But again, we can prevent new spot formation, because the ones that you see, they're like the tip of an iceberg. And again, so yes, you still see that spot, but you don't see new spots. This is also a good result for the treatment. So that differs what kind of etiology the patient has, how long they had this hyperpigmentation, and it also depends how precise this person is, how much time is he willing to invest in the treatment, because again, this is not a 1 day or 1 month treatment. This is a change of a lifestyle, and again, the results come, I would say, within 3 to 6 months. So it's very, very slowly. And once, like, whenever every day you go to the mirror, you still see it. But again, with these results, is like I say to my patients, like, take some older picture, like 10, 20 years ago, and you will see that there aren't those wrinkles. You don't go to the mirror and, this one appeared, this one appeared. We get used very, very quickly. And that's why we take photos of patient and we evaluate only in 3 to 6 or even longer period of time to see the results. It's very, very slowly. So that sometimes annoys the patient, and it's understandable, but it just takes practice and patience as well.
What do you think about like procedures that are fighting the pigmentation, like lasers?
They're good, but they're not the only ones. I would say if someone wants to treat hyperpigmentation, there are 3 like mainstreams, I would say. So again, sunscreens, a lot of sunscreens every single day. The next one are creams that brighten the skin and decrease the activity of melanocytes. So that is the cell that produces the melanin, so something that we see on the face. And then we can talk about the procedures like lasers, chemical peels, microdermabrasions, or any kind of that. So that's basically energy-based devices. But they only deal with the pigment that is already made. They don't affect the cells. So you have to use all 3 of them. Sunscreen will block the UV rays, so the stimuli will be less visible. Brightening creams will often reduce activity of the melanocyte, like tranexamic acid, and then we can add these procedures. You can do lasers, but if you don't do the last 2 mentions, then it's not going to be as effective. And you always should start with skincare and only then procedures, because energy-based devices, sometimes they can actually promote hyperpigmentation if they are not used properly. So it depends from every patient to patient.
What's your personal favorite thing in a skincare regime, and like where do you see the best results for your own skin? Because there are so many skin types and everyone needs like different products and procedures, but what's your personal favorite?
Lots and lots of sunscreen. A very scrupulous skincare regime, because I have a problematic skincare. I have an adult acne, so therefore I know these challenges with hyperpigmentation, pimples, and even tone and things like this. I would say that I benefit very greatly from the regime. No alcohol, no smoking, no sugar, but all of us wants to have a glass of wine from time to time to eat something sweet, but then afterwards we see that on our faces. Regarding creams, it depends also from the season, because we have to be aware that, like, in our place where we live, like in Latvia, we have 4 seasons. Probably we have less winter. Last year is more like autumn, but again, so we had a lot of central heating, therefore the skin dries a lot, and as a consequences we see oilness of the skin. And so regarding your question, these products also change based on the season, based on the problems I have, and also what I do, if I'm more in the office or if I'm outdoors. I see a lot of benefit from acids and retinol, but my skin takes it very, very easy, so that is not a problem for me. And also I benefit greatly from lasers and from injections as well. But again, you shouldn't do anything like too much. Even though I work in this sphere on an everyday basis, I think that you just need to do some touch-ups from time to time to give some stimuli to treat what potential problems you may have, and then target them. But not to be like over, I think, crazy about procedures, because as we talked about, all energy-based devices, all injections, if you start to do them too often, then actually the skin deteriorates from that. So we have to be wise how we combine, because every energy-based device, so that is heating. So again, we have to be smart what we are doing with that. But again, don't get me wrong, lasers are the best that you can do for your skin. Skincare routine is also the best, but just every single person needs something different. Maybe even the same equipment, but different type of energies, different type of protocols. And combining them, we can have an excellent result.
Thank you, Kristīne, for joining us today. And thank you for watching CARELIKA Talks, where we touched very important topics today: anti-aging, wrinkles, pigmentation, and acne. So if you have any more questions, then always feel free to comment right down here and ask your questions so we can answer them in our next episodes of CARELIKA Talks. My name is Markus, and that's it for today, and see you soon, and shine bright.